Hi everybody, part two. So I know the last video, I know that I'm gonna have to do some parts because I chit chat a lot and I get off course, but I really wanted to make sure that I give as many details as possible because I'm making these videos for people who are curious about the process, for people who have friends and family who are going through this, or for people who are just curious about what's going on, or maybe you're listed and you have no idea what it's going to be like. People ask questions all the time, so I'm just trying to give some give my experience so that you guys can take what you can from it, and ask any questions, leave any comments or questions down below. So last I was talking about was day 6 and 7. So yeah, I felt like I just couldn't breathe. Oh, I also forgot to mention, like, every time I made a video, I got my transplant on my anniversary, on my wedding anniversary. And that day was so crazy that I didn't even remember to mention it. That night we were actually supposed to go out well, not go out, but just order takeout from a restaurant. Because, it was my 6th call. At this point, I was just kind of like, these people are just calling me. And yeah, I'm going back home later. I didn't even bring a bag of clothes, I don't think. Did I? I don't think I really brought anything because I just honestly thought I was going home. I was like, okay, this is routine. We're gonna go, they're gonna tell me the lungs are not for me, whatever. And yeah, lo and behold, those lungs were for me. So I didn't really have much, and I didn't think that it was gonna go through, but it was my wedding anniversary. So I felt like that was a really good sign because 2 great things have happened on that day. And yeah, I just wanted to throw that in there. I know other people have had really good coincidences when they were getting their transplants as well. And yeah, so don't feel bad if you're getting dry runs, because I got 6, well 5. And all those other dry runs are posted on our YouTube channel, so if you want to watch them. So yeah, so by that time, by day 7, I had this mask on all the time. And they decided, of course, they do daily x-rays. I think they do like 2 x-rays, like 1 in the morning and then 1 in the afternoon. So yeah, they were on top of everything, checking vitals, doing everything that they had to do. So they did another x-ray. I think they had me go downstairs, which was not fun because I wanted to be on my BiPAP. I wanted to be on the BiPAP 24/7. Anytime they were like, okay, Ruth, you gotta take the mask off, we're going downstairs, I'm like, and really, because I think they only let me go down with the BiPAP once, and then when they brought me down for the second surgery, they had me wear one of those oxygen masks that can go up to 15 liters, and that kind of like made me feel less anxious. But either way, guys, I had been breaking down all of week 1. I'm just be honest with you. I was not doing good at all. Like, I had this respiratory therapist. I'm sorry, I'm really bad with names. I don't remember her name, but this lady came in every day to check on me. She used to give me my respiratory treatments, which were albuterol and I think another antibiotic, which I'm not on anymore. But she would come in twice a day. I had her most days, and she just like hold my hand and talk to me and just be like, you're great, you're amazing, you're everything. Like, she's trying to give me like a mantra, trying to give me like positive affirmations and stuff. And I was like, no, I'm done, I'm ugly, I can't breathe, I'm dumb, oh my god, like everybody else can breathe but me. Like, I was like the biggest crybaby, like the biggest cry. Like, I don't know, like I would be like I would tell nurses, I know that you can't stand me because I'm always complaining, and they'd be like, no, it's a major surgery, Ruth, don't say that, don't be hard on yourself. And I'm just like, you guys hate me, I'm always calling you. Like, especially when I was having a hard time breathing, I had a hard time being alone. So anytime like the machine beeped, I would press the button. Anytime I felt like I was suffocating too much, I press the button, come put the BiPAP on me. Anytime like I was not playing, like I would press the button. And if they didn't, if 10 minutes went by and they didn't come back, especially when I had to use the bathroom, I pressed the button. I'd be like, nobody came to help me use the bathroom yet. They're really good in the ICU though. Like, they're really on top of things. And if the ICU where I was, thank God, every nurse, like most ICUs, they only had one. They just had me. So yeah, but Yeah, I was like, they were like, no, don't worry, we have much more extra patients than you. There, trust me, there are other patients who are really demanding and rude. And I was like, I'm not demanding or rude, but I know I'm a crybaby though. I know that. So yeah. Um, but yeah, they be like, oh, don't worry, you're my favorite patient. I'm like, you say that to everybody. You say that to everybody, but who knows? Maybe they were telling the truth. Um, so yeah, and they kept turning the vitals around to make me feel relaxed. They were like, oh, your blood pressure looks amazing. Your oxygen, amazing. Your sugars under control. Ruth, you should be happy. You should be grateful. I'm like, I am happy and grateful, but I can't breathe though. I have to have this mask on. The oxygen was not helping. So after they checked that x-ray that day, I think day 7, they were like, the doctor came back, he was like, listen, we need to go back in. And I was just like, okay. I was so tired of saying, I didn't care. They were like, he was like, listen, we're gonna have to go ahead and do a wash. So a wash is a procedure, surgical procedure. They're gonna have to open you back up the same way they went in, okay? Which is, for most people, just like an incision. That's for men and women. Like here, some people have theirs here, but for the most part, I don't know if you can see, they do it like this. Okay, so men and women, that is usually the cut that they do. So I mean, you're not gonna have like a big scar here, but some people do have to be opened up like this. But they say, I think 90% of the time, they go in like this, and that's what they did to me. So, so where was I? Yeah, so he was like, yeah, we're gonna have to do a wash, and I'm just laying there. I'm like, okay. He's like, we're gonna have to go back in. I'm like, okay, do what you gotta do, because I'm not gonna make it anyway. And so he's like, listen, there's fluid in your I think right lung. There was fluid in my right lung. They didn't know what it was. They don't know. They thought maybe I was aspirating, which basically means, you know, just like I was talking about with the swallow test. They were afraid that, you know, I had accidentally drank liquid, and that maybe the fluid had accumulated into my lungs and I had not swallowed it right. You can't drink or eat when you have the feeding tube, not until you pass the swallow test. So the only way that would happen is if like you were sneaking water or something, because they do give you a small little itsy bitsy, like this in a cup, and then you have to suck on a sponge. If you're thirsty, you suck on the sponge, and they give you a mouthwash. Listen, I was going through a bottle of mouthwash per day. They give you this mouthwash which helps you. I forgot the name. Biotin. They give you this mouthwash, which is you swish it around your mouth and makes your mouth feel less dry. So if you're hungry, suck on the sponge. If you're thirsty, suck on the sponge. Oh, look at that. My husband brought it for me. There it is. Biotin. I even have a bottle at my house. Biotin. Dry mouthwash. Biotin. Dry mouth or rinse. Good stuff. Yeah. So, yeah, that's prepare for that. You will be sucking on a sponge until you are cleared. So moving on, I was constantly in prayer. So yeah, so they planned to do it the next day, I guess day 9. No, day 8. They planned it immediately. They were like, we're going in. So they had a very good surgeon do it. And I woke up from the anesthesia feeling better. Problem was, I was on a vent, guys. Most traumatizing thing I have ever felt. I'm sorry. I know some people were like, I was at ease. Maybe people were like, I was at ease. I've been on a vent before. Not for me. Not for me. Once again, not for me. I was on that vent for like 10 hours. I was awake the whole time. Okay, they tried different sedatives. They were like, just relax, go to sleep. I asked them for my phone. The nurse was like, no, she put it across the room. I was like, I tried to watch TV, but you can't move. So the machine was on my right, and I'm laying there. You can't move, right? And they strap you down. They strapped me down. They strapped my arms down, and they strapped my legs down. So I would not move. And they were like, it's for your own safety. Because when they first woke me up, I would try to kind of like pull the hose a little bit so I could watch TV because I was bored and I didn't have my phone and I couldn't fall asleep. So I tried to reposition it. I guess the nurse saw me through the window because she was watching me because she knew I was shady. And she knew I might try to do something. I don't know. She came back. She was like, let's go ahead. Just tie these back up. Let's tie these babies up because we don't want anything to happen to your tubes. I'm like, oh my gosh. So she ties me up, my legs and my arms. I can't move. So you're just like this. And I'm like this the whole time. The whole time. And I could not fall asleep. She kept giving me, I kept asking her for stuff, asking her for stuff. I was like, give me something stronger. They gave me 2 different things. It did not work. I stayed awake the whole time. So they woke me up from surgery again in the afternoon. Okay, I will admit I did feel better, but except for the tube that was stuck down my throat, which was very, very uncomfortable. Even obviously more uncomfortable than the feeding tube. I could literally feel it all the way down there, forcing my lungs to expand, which was good because you're supposed to give, I could see what the doctors were doing. They were trying to give my lungs a break because they thought, you know, obviously I'd had a very hard time prior breathing and being able to breathe deeply because I was not used to new lungs, and also because I was also in a lot of pain. So they wanted to make sure that I could get used to taking deep breaths, that, you know, my CO2 was good and all my levels were good in terms of my oxygen and all the other factors before they took me off. But let me tell you something. Every time that nurse came in, and they come in a lot because, again, they're checking all your vitals, and if they need to give you something or, you know, pump another drug into you or something just to stabilize you for whatever reason, they're there. So literally my nurse is coming in and out of my room. Every time she comes, I am so annoying. I had asked her for a board and marker. I was like, can you take it out? Call the respiratory lady. Can you take it out? Call the respiratory lady. The respiratory lady came 3 times that night. And she's like, you're doing good. You're doing great, but you're breathing over the machine. I need you to relax. I was like, just take it out. She's like, you need to relax. We need to know that you can do this on your own. I'm like, I'm good, baby. Take me off. Take me off. Like, I had emojis that I was drawing on the board. I was like, I'm good. Take me off. I'm ready. I felt like a caged animal. I was like, I can't. I was just literally just laying there. I couldn't move. I felt like I was in jail. Like, I don't know. I don't know how to explain it. It was just bad. I know some people are on it, but they, you know, maybe if I slept through it, I wouldn't have felt bad, but I felt really restless, and I just spent that time just kind of thinking about everything and how ungrateful that had been. I think, you know, it happened for a reason. It gave me a lot of time to think. So I was just thinking about, you know, how grateful I should be that I'm alive, that I can breathe, and that once they take this thing out, they're going to let me eat, they're going to let me drink. I'm going to be able to walk and just feel much better. I could already feel that I was breathing better with the vent. And, you know, I felt clearer. And later on, the doctor had told me that the fluid was actually blood. And that blood had accumulated, but they were able to get it out. And there was also some other, yeah, it was just blood. So they were able to clear that out, and they were happy about that, that it wasn't something that I had, you know, that it wasn't that I was aspirating or anything. They wanted to do another swallow test, but I told the doctor, I was like, I don't think that's necessary. I convinced him that I didn't think it was necessary, and he was like, he'll think about it. And eventually, yeah, he canceled the second swallow test because that meant that I was gonna have to spend another couple of days with the feeding tube, which I eventually took out by accident because, you know, yeah, I accidentally had pulled on it a little bit because it was like, because it's like right here, it's like on top of your lips, so and then it's taped, and like it's uncomfortable. So a lot of times the tape is coming off, so I'll like fix the tape, and then you have to be really gentle not to tug on it. And apparently, yeah, it's slowly been coming out, because when the tape comes off and then it's dangling, the little tube is dangling or whatever. I don't know, it had come out a lot. They went and did an x-ray, and another x-ray, and they saw that most of it had come out. So they were like, let's just take it out and just put another one back in. Again, putting a feeding tube in is not fun either. So I was just like, no, please. You know, I passed the swallow test or whatever. I'm sure I'm fine. And the doctor felt bad. He was like, okay, you've been through a lot. We'll just deal with it, you know? So yeah, I'll continue talking about our journey in the next video. I know I have a lot to say. Again, just trying to give you guys details, but see you next time, okay? Bye.